Thank you very much, Mr. Speaker. Mr. Speaker, I thank God that I'm able to rise to my feet to make my contribution to this debate on the appropriation bill as presented by the Minister for Finance, whom I thank for his humility, bravery, creativity, honesty in preparing and delivering a budget statement of hope. As he stated, Mr. Speaker, we are on the right path, but we must complete the job to secure a brighter future for all the people of St. Lucia, and I'd like to use the sons and daughters of St. Lucia. Mr. Speaker, I embrace this hope, this brighter future. I ask that the Lord guide us through the implementation process, because after all, Mr. Speaker, if God is for us, who can be against us? Mr. Speaker, at this time, I wish to refer to the message of Her Excellency, our Governor General Dame Paulette Louisy, who in the delivery of her throne speech invoked the indulgence of honorable members to break with stately convention as she paid tribute to the triumphs of our youth in their respective disciplines. Mr. Speaker, I also wish to refer to our own social scientist, Dr. Tennyson Joseph, who warned, you must, in the formulation of your policy agenda, build on the strengths of our youth rather than focus on the social ills associated with their presence among us, unquote. Mr. Speaker, it is in this context that we in Babonneau hailed our stars who brought home medals from various games and championships in the persons of Laverne Spencer, our high jumping queen, Denzel St. Mark in javelin, Julian Bissett, Ace Louis in high jump, Kimani Melius, the captain of the under-15 cricket team, who led the team to its second title in 2015, the Windward Islands Under-15 Cricket Championship. And Mr. Speaker, as a leading batsman in a recent local tournament, scoring 275 runs. Mr. Speaker, he's from Borges in Babonneau. He has cemented his place on the team to Tour Guyana this year, July. I feel so proud to inform honorable members that this 15-year-old cricket giant of the Babonneau Secondary School, his nickname, Mr. Speaker, is Farmer. Mr. Speaker, Farmer. As I contemplate the theme of hope, I am reminded that youth is a season of hope, enterprise, and energy. Mr. Speaker, some may think it's a season of noise, but I beg to disagree. And the words of Desiderata comes to me. You can speak your truth quietly and clearly. Mr. Speaker, earlier I heard the MP for Castries Southeast speak of the reason why he wore the colors, because he was mourning. And that, for me, Mr. Speaker, is so disappointing, as I know him to, well, I assume he is a Christian. So when things are looking bad, I know Christians raise their head up high. Hence the reason why I'm wearing green. That's a color of hope. So I can't imagine why somebody who claims to be so faithful and believes in the Most High, who gives courage and strength, can come to sit among us members and tell the young people that just give up and call it death and call it quits. You don't throw your hands into the air as a leader. You fight till there's nothing left in you. And this is what the message I want to send to the young people of this country. Mr. Speaker, I thank all the hardworking constituents of Babonneau who continue to embrace the values of hope, enterprise, and energy so passionately throughout 2014 and in 2015. Together, we danced, we created, we prayed, we enjoyed football, we supported each other, we challenged each other, and I said to them, Chebe fo, Pamuli. I also salute, Mr. Speaker, the officers attached to all departments and institutions of the Ministry of Health, who continue to work diligently on behalf of all St. Lucians and visitors. Hospitals, St. Jude, Victoria, Soufrière, Dennery, health centers, all 33, polyclinics, mental wellness, Turning Point, Human Services Department, Gender Relations Department, Environmental Health Department, the administrative building, especially the PS and our new DPS, who give their time, talent, and treasure to cultivate that hope, enterprise, and energy in their day-to-day undertaking. Mr. Speaker, my greatest thanks to God. Mr. Speaker, so much to say, but I shall go very quickly, and I hope, Mr. Speaker, to get to the end of it. Mr. Speaker, still on the topic of youth, I move quickly to the Prime Minister's address as we address insurance coverage for national athletes. A welcome plan, Mr. Speaker. Excellent way to show support, to motivate athletes and their family. Mr. Speaker, benefits for people like Gemma Bridget, Malaika Moise, and Marlene Preville, who are female cricketers. Venantius Gabriel, and of course I mentioned Farmer, who are male cricketers. Bianca Alfred, Jemiah Everest, who are netballers, and so many more from the Babonneau constituency who are representing St. Lucia. Mr. Speaker, Albert Reynolds. And Mr. Speaker, I understand the anxieties because just recently, as a conclusion of the Alvina Reynolds football tournament, one 15-year-old goalkeeper got injured. And the mother was very traumatized, sitting there after midnight while we wait for the ambulance to come through because she was wondering if everything was okay with her son. Far less when they are overseas representing St. Lucia and they get a little anxious about the expense. So I want to thank the Honorable Prime Minister and Minister for Finance on behalf of all parents and loved ones of our national athletes. The lighting of recreational facilities, Mr. Speaker. Number 3 indicates the Fonso playing field. Say no more, the best news ever. The 16 or more football teams from Babonneau welcome this news, Mr. Speaker. And not only football we talk about, but we talk about other activities. For example, track and field in the name of Love and Spencer. And Mr. Speaker, there's so much more. Economic activity, where there is food and drinks on sale, craft and DJs showing their craft. Mr. Speaker, my apologies. This will bring excitement to the community of Fonso. Mr. Speaker, I want to thank again the Minister and the Minister for Youth Development and Sports. Mr. Speaker, when you thought that your constituency had 3 playing fields with lights, only to realize that the former MP lit up the Balata playing field, and I've been informed that the field is located in Castries North. And so I really want to applaud that plan to bring lighting to the Fonso playing field. Community Access Center, access centers and the Gara community stands to benefit. Likewise, the Babonneau Library. Mr. Speaker, opportunities for young women and young men to receive training. For young people who are not in Form 3 and Form 4 to get access to computers that they may be able to do their research and to complete their home assignments, the classroom assignments. Mr. Speaker, moving on quickly into the management of Black Sikatoka. Much progress has been realized, Mr. Speaker, by the Ministry of Agriculture and the farmers of Babonneau. The farmers needed this intervention, Mr. Speaker, and they got it. I want to say to the Minister and the MP for Vieux-Fort North to press on. So on behalf of the farmers, the farmer qui sorti Poidou, Koba, Maki, Monasso, Chassin, farmer qui a planté banane, ek fig, Makadi, Messi. There is green all around in the hills of Babonneau. The Land Bank Initiative, Mr. Speaker, another such initiative very welcoming to secure appropriate crown lands, abandoned and other private lands, so that we can look at agriculture in a bigger way. Mr. Speaker, I've been told that the average age of farmers in St. Lucia will be 55 years. They are getting older, and the younger ones who are interested in managing their own farms do not have land and do not have the finances to buy land. And so, Mr. Speaker, this is one way to bring support to young people, to reduce unemployment, to encourage people to grow local, to eat local, buy local, therefore seeing a healthier group of St. Lucians. So this is an answer to the unemployment situation in the country and in Babonneau. And as I speak of unemployment and agriculture, Mr. Speaker, just to touch a little bit, as our young people are moving into agriculture, I think I hear the cries, and we all do, of predial larceny. There are some who do not cultivate, but they harvest. And Mr. Speaker, si la pani sitiles, la pani vole. If nobody's buying, people will not be selling. But I think there's one thing that we need to look at, and probably the predial larceny teams could be housed at police stations and to work along with police officers within the communities so there is a quicker response time to get to the farms, and also, Mr. Speaker, to build capacity among the predial larceny teams. My little 2 cents on that one, Mr. Speaker. Moving along to tourism development program. Development of new tours. And I saw La Saucière in Babonneau. Waterfall tours. La Saucière, where we can explore caves, we can explore bird watching, camping, turtle watching, and I want to inform all, Mr. Speaker, that we have resumed with the rangers on the beach at Grant Anne's, thanks to the NICE program. They are helping to protect the turtles from poachers, and I've understood that nesting, we have witnessed turtles coming up to nest, so I want this to continue, Mr. Speaker. Marquee estate tours, the agro-processing plant, and Mr. Speaker, even in the budget estimates, there is some allocation for l'encens, which is incense, being extracted from the trees in the La Saucière forest and being manufactured right there at the agro-processing plant and to be exported to countries like the UK and Martinique. I understand there's a large market and they absolutely love St. Lucian incense. So there is another way for employment for our young men and women, Mr. Speaker. I have even spoken to some men who have been trained in that area of extracting that sap from the tree very carefully so as not to kill that tree, but of course come back another time later and extract some more. Folati sap tours, the farmers market. Mr. Speaker, speak of it. Ecotourism, agotourism, adventure tourism, heritage tourism. You mention it, we have it in Babonneau, Mr. Speaker. So it's a matter of working along with the Minister for Tourism, the Tourist Board, and other agencies to help mine that gold that we have in Babonneau, Mr. Speaker. I see jobs, more jobs on the horizon for our young people. I see jobs for the young men and women of Chassin, Fourasson, Bogis, Gara, and other communities. Mr. Speaker, as we move to development of creative industries, I really would like to thank and congratulate the MP for Choiseul, Saltibus, and of course the Minister for Tourism, because the increased airlift that we saw, increased spending, Babonneau has benefited. Through, Mr. Speaker, the tours, the sky rides, you name it, the constituency of Babonneau has benefited. Mr. Speaker, we are an agrarian district. We are into Creole, Kwela vivant en Babonneau. Our own generation of Kele, Solo, Tabu, Court, you name it, Mr. Speaker, we've done it in Babonneau and we continue to do it. And whereas we may not push for jazz again in Babonneau, Mr. Speaker, we have our own unique festival. And I welcome the Festival Commission because there is something big that will happen in Babonneau this year. And of course, Mr. Speaker, art in public spaces. And as you see it in many countries, Mr. Speaker, beautiful. And I look forward to the opportunity to tour with the minister, though he tours when I'm not around. I look for the opportunity to tour with him and show him areas where we can put in art in our spaces. Mr. Speaker, I'm moving on to infrastructure, feeder and agricultural roads. Good relief for our farmers who feed the nation. But I need to list a few roads under this one, Mr. Speaker. Those roads may not be included under the BAM project. Poidou Road, Chassin to Bourgis, the Maki Road, the Family Lane Road in Laguerre, Babono. Mr. Speaker, all kinds of vegetables, fruits are being harvested, cultivated in the areas of Babono. And so the farmers do need some relief. I understand a few, maybe years ago, a full truckload of bananas actually capsized in a bad road climbing a hill, Mr. Speaker. And that's something to break any farmer's heart. But, Mr. Speaker, I raise it here and we continue to speak to the Minister for Infrastructure, Minister for Finance, so at least we can work a little faster to get some relief to the farmers of these areas. But, Mr. Speaker, there's good news for us for roads as we look at Savannah Ho between Bourgis and Laguerre, the 0.7 kilometers of roads. Yes, Mr. Speaker, long waited and being delivered. It is better and brighter for the people of Savannah Ho. Mr. Speaker, but I still want to mention the Debarra Road as it serves the churches of the Church of God and SDA and the students of the school on rainy days all are stranded. Mr. Speaker, under the Hurricane Thomas Rehab and Reconstruction Project, great partners we see with CDB and the government of St. Lucia. We thank the Prime Minister, Minister for Finance, and the Minister for Infrastructure and their teams for this great work. Mr. Speaker, I take note of the General Road works expected to commence in July this year. Mr. Speaker, this again, the slope first. However it starts, Mr. Speaker, we are very pleased. And Mr. Speaker, you have more people living in the Babono district. And so we traverse to the Mon, to Vieux-Fort, to Soufrière, all of us through this road, especially the female drivers who are scared to climb up the Jiwa Hill. So when they have a flat road to traverse, it's easier for them. So, Mr. Speaker, we are quite elated to hear at least something will be happening in that area of Geno, linking Geno and Babono. I move to education, Mr. Speaker. Free vision and hearing tests for children of grade 2. Children with learning impairments. Mr. Speaker, and sometimes we diagnose wrongly. We think children may have mild or moderate learning difficulties. But with this diagnosis comes the intervention. Because every child deserves a chance. And this, Mr. Speaker, is what this Labour Party has pushed for quite a long time. Opportunities for all. Opportunities for our children. Opportunities in education means opportunities for empowerment. So I really embrace this one for the free vision and hearing test for children of grade 2 just before they go through the minimum standards exam. Mr. Speaker, basic education enhancement project. There isn't one budget debate where we do not mention Foaso and Laguerre. But we know Minister spoke to that earlier, Mr. Speaker. Started very slowly, crawling along, and it broke my heart. And Mr. Speaker, now I see a little more movement, I may say, to the Honorable Minister and the MP for Castries South, a little more movement at the Foaso School. And so I am using, through you, Mr. Speaker, that to encourage them and to say, let's move a little faster because we need this school and we need it fast. But we want, of course, that all things are done according to protocols. Mr. Speaker, Laguerre, and of course, Minister addressed this earlier, that's for a different discussion, but I know the principal, staff, students and parents of the Laguerre Primary School, they have endured for quite some time. Mr. Speaker, there was water collecting right in the yard of the school, and through the CDP, thanks to CDP, we were able to put a concrete slab that they use now for assembly, they use for sports, and so there's no more stagnant water in the area, the front of the school. But they suffer with termites. They endure quite a bit, Mr. Speaker, so I say to them, hold on, when it's possible, all will be done quickly to deal with that matter. Mr. Speaker, the Prime Minister spoke of strengthening social protection, and he spoke of the government demonstrating compassion and care for the most vulnerable in our society. Mr. Speaker, I want to pause just a little while and speak to one particular experience I had with a lady from Paybush who had some difficulties with a home caregiver. And the caregivers were pulled out for a little bit because they were trying to come to an understanding. And I must commend the supervisor, and he's male, Mr. Speaker. And he went through the home caregivers, he went through his supervisors, he brought in persons to mediate with this lady to ensure that she got what the government was paying them for. And when all else failed, I got to know, I called him, and he was waiting in that gap for me, Mr. Speaker. And we went to visit. And there I was, of course, not MP anymore, but wearing my counseling cap. And Mr. Speaker, I was so proud of this young man, Jada Emmanuel. The way he was able to reason with this lady, the way he was able to listen to her needs and to listen to me, and they came to an understanding. And at the end, she said to him, touch me. He said to her, you mean to tell me the MP had to come here to help us get to that point? Because he was so eager to get to that point, Mr. Speaker. And I really want to say hats off to persons like this supervisor, Mr. Speaker, and all the other home caregivers under NICE who have been trained so well and who execute so well on behalf of the elderly in all constituencies in St. Lucia. Mr. Speaker, 325 of them, 324 ladies and 1 gentleman. Not gender balance yet, but I'm hoping the next time round we may get more than that. But as we speak of social protection programs, Mr. Speaker, we look at social services for vulnerable boys and girls. Mr. Speaker, there are many young men and women, boys and girls who suffer from emotional and behavioral difficulties in this country, whether it's because of child abuse, whether it's because of alcohol abuse, you name it. They are vulnerable. They are in need of protection. Some of them are in conflict with the law. And Mr. Speaker, just to reassure some of our youth advocates, to reassure some of our social workers that the Ministry of Planning is working on the design for the home, the residential space for boys, vulnerable boys and girls of this country. A new site has been identified. This is all I'm going to say to them, to give them that hope that the government did not forget. The government, the Prime Minister did not forget, but just want to give them that assurance. And of course, Mr. Speaker, looking at the Juvenile Justice Project, all ministries being included, social transformation, health, legal affairs, home affairs, to ensure, to look at the legislative landscape for our juveniles, to ensure proper legislation is in place, Mr. Speaker. And this is what we place value on in this government, Mr. Speaker. Not only infrastructure, economics, but people, human resource. This is where we show that compassion, the empathy. And when I say I speak to the Prime Minister about being humble, he delivered humbly. That's what I'm referring to, Mr. Speaker. And I will not forget, at the very first time at budget presentation, the Prime Minister did ask about the social programs that was discontinued by the former administration for persons who are living with HIV and AIDS. He asked about it. We informed him that it had been discontinued, and immediately it was included. So let's talk about caring government. So when I hear a lot of noise on the side opposite about doing things to hurt the people of this country, I wonder What are they listening to? What are they reading? Or is it just because we have a voice that we can say anything, Mr. Speaker, and then accept no responsibility for not speaking the truth? Mr. Speaker, I move on to the CDP. Road construction, and I'm pleased that the Fonkako Road is 70 households, and I thank much for that. Other roads that we will tackle, Mr. Speaker, the Lafitte Road in Cabiche, Africa Road in Balata, Timon, Mondidon, Ital Street, Chickenback Street, Pussycat Lane, Park City Lane, and Kue Road in Kako. Mr. Speaker, there are many more roads that we will tackle through CDP, Mr. Speaker. The multi-purpose court in Timon, Mr. Speaker, has been identified by the Minister for Finance. 2 courts commenced, Mr. Speaker, in less than 2 minutes drive apart from each other in 2 communities that link each other, and already there's a court linking the 2 communities. I do not know where people learn these planning strategies, Mr. Speaker, but 2 courts started with no monies left to complete, Mr. Speaker, but I want to thank the Minister for Finance and Infrastructure and all, Mr. Speaker, will help us complete 1 court, and that is in Timon, because the majority of the young persons live in the Timon community and not in Union Terraces. Mr. Speaker, we will commence the Bogies Court. And Mr. Speaker, as I say Bogies, I recall one gentleman. No greater love there is than to give your life for your friend, Kenneth David John, former MP for Babono, who gave his life trying to save a young lady. Mr. Speaker, he was a taxi driver, a farmer, a teacher, fire officer, and avid sportsman. Mr. Speaker, and looking at possibilities, what can we do to honor this man, as this year we observe the 17th year since his passing in the treacherous waters of Grantans. And of course, we look at it, Mr. Speaker, the values that he held, Mr. Speaker. And of course, Babono, David City, this is what we embrace, the values of love, humility, and care for others. Mr. Speaker, I move to health infrastructure. And Mr. Speaker, I will take a little time to deal with health for many reasons. And there are some students I would like to sit here to teach about health, but they are not here, unfortunately. Mr. Speaker, it's not only about the infrastructure when we speak about health, but yes, there is good news, very good news, excellent news, about the new National Hospital, the Owen King EU Hospital, to be commissioned this year, and both St. Jude as well to be commissioned during this financial year. And with the new National Hospital, the cafeteria, laundry, signage, Mr. Speaker, we've spent so much as it pertains to equipment, Mr. Speaker. Radiology equipment, surgical instruments and equipment to be installed between May and September 2015. Mr. Speaker, all what we have so far amounting to $38.4 million. Mr. Speaker, just recently we got 15,000 small pieces of instruments to have in the new National Hospital. Of course, we have been very careful as it pertains to security. Each one, Mr. Speaker, we had to check and assure that they were received and they are quite safe. Mr. Speaker, as the ministry, we plan to invite the members opposite to a tour of the new National Hospital. Mr. Speaker, I recall last year, the Prime Minister offered and said to the members opposite that they are welcome to visit St. Jude Hospital, but they had questions. Mr. Speaker, I didn't think the Prime Minister had to tell them that they had to call ahead of time. There are protocols to be observed. Mr. Speaker, they showed up on the site outside of the gate expecting to be let in, informing no one. Now I was in Soufrière dealing with a matter at the hospital in Soufrière, to be called and told that the lineup outside of the gate of St. Jude Hospital demanding, because the Prime Minister said, I mean, Mr. Speaker, if we have leaders who don't even know basic things like this to communicate and request ahead of time, because this is a work site. You needed to have the right hats. You needed to be clad properly to walk the site as the Minister for Infrastructure. And you show up at the door, at the gates of the St. Jude Hospital, demanding and huffing and puffing about not allowing one in. Mr. Speaker, I will say to the members opposite, we will write to invite them to a tour of the new National Hospital. Don't show up. Don't show up. We will call you. We will make all the arrangements for you. Since you do not know how to deal with it, I shall teach you the protocols. Mr. Speaker, moving right along. A great deal of work has gone into St. Jude Hospital, Mr. Speaker. And of course, there is so much more to do with St. Jude, Mr. Speaker. Reports, years and years of audited reports to be submitted so we can have a good idea as to what has been happening at St. Jude Hospital, Mr. Speaker. And this government continues to demand the reports from St. Jude Hospital, Mr. Speaker, so we get an understanding, a clear understanding as to what exists at St. Jude Hospital for more than 5 years. And Mr. Speaker, they're looking at some strategies. One, I quote from the budget policy notes, Mr. Speaker, elimination of the backlog of audited financial statements. Expected timeline for completion, Mr. Speaker, was April 30th, 2015, not yet received. Conducting a comprehensive workforce analysis to determine the most efficient complement of staff needed to run the hospital. To complete and implement a much-needed hospital costing exercise. Reduce wastage of hospital medical supplies and pharmaceuticals by closely controlling stocks, monitoring usage, and tracking expiry dates. Improve the efficiency of hospital debt collection. Mr. Speaker, the team at St. Jude, they're very much aware of what some of the problems are. But when you hear this noise in the media, Mr. Speaker, people do not understand, they do not want to understand, and it's all that the minister or the ministry is not paying attention. We move on, Mr. Speaker, and I heard the question this morning about the commissioning of the hospital. It takes about 6 months, Mr. Speaker, to commission a hospital. There are lots that goes into it, Mr. Speaker, and we are working with both St. Jude and your National Hospital alongside to ensure that all goes well. It's not just equipment and move people, Mr. Speaker. There is a process to go through to ensure that you commission well, the transition is smooth, and so the hospital continues to function as efficiently and effectively as possible. But, Mr. Speaker, the plan is always to strengthen primary health care. But as I move on, Mr. Speaker, I want to give you some information and some statistics as it pertains to Victoria Hospital and St. Jude Hospital. And I want to thank the staff at both St. Jude and Victoria for that information. Mr. Speaker, from January to December 2014, patient occupancy at Victoria Hospital, 65.3%, at St. Jude Hospital, 57.8%. Mr. Speaker, births at Victoria Hospital, 1,145 births, stillbirths, 15, percentage 0.013%. When you look at stillbirths. Births at St. Jude Hospital, 734, Mr. Speaker. Out of that, 12 stillbirths. Percentage, 0.016%. We were not satisfied with this, Mr. Speaker. We called in the assistance of PAHO, who came in and did an audit, assessed what was going on at the hospital levels to understand why we recognized the 15 stillbirths at Victoria and 12 births at St. Jude. This is a government and a ministry that shows that they care. We didn't leave it like that. We tried to find out what cause stillbirths. The percentage is 0.013%, not even 1%, not even half of a percent. Likewise for St. Jude, 0.016%, not even quarter. 0.25 is quarter, not even close to that. So, Mr. Speaker, we look at admissions at VH, 8,400. St. Jude, 3,622. Accident and emergency, 22,322. Outpatient visits for the year, 15,875. Nephrology, you're talking about kidney, Mr. Speaker, 9,328. At St. Jude, Mr. Speaker, admission and visit, 47,727. Mr. Speaker, look at clinics at the hospital. St. Jude, diabetes, 1,894. Orthopedics, 1,879. Pediatrics, 2,000 plus. Mr. Speaker, when you hear the cry about the hospital failing, the health sector failing, we talk about this is just tertiary institutions. You have primary, you have secondary, and you have tertiary. And I'm going to touch on all the other departments given the time, Mr. Speaker, because when persons make such statements, it shows they have no idea what the health sector is comprised of. If you did, you'd not use what is happening at one tertiary institution to say that the health sector is failing. Total ignorance on the part. And the member for Castries Southeast, let me not confuse the two, though they come from the same church. One time in the media, Mr. Speaker, speaks of he being at Victoria Hospital and someone crying without a pillow. Mr. Speaker, this is not, what's the name of the hotel? This is not Coco Palm Hotel. This is a hospital. People cry at hospitals. People suffer at hospitals, from men to women. I visited Shanghua Christian Hospital in Taiwan. Mr. Speaker, people were in wheelchairs crying, people were in pain. Never see a hospital and people behave like it's a hotel. Somebody got confused along the way. They spent too much time somewhere. Mr. Speaker, if there is that recognition that a pillow is missing, as a concerned member of the community, you find the executive director, you ask a question. You don't leave the hotel, leave this person without the pillow, whether it fell beneath the bed, nobody knows, and go to the media to talk about a pillow. Somebody didn't have a pillow and somebody's suffering. This is such pettiness, Mr. Speaker, when we can stand up and go to the executive director and ask a question and deal with the matter. This is what I expect from leaders, Mr. Speaker, not this pettiness I see happening every single time. And Mr. Speaker, we accept responsibility. From day one, when we entered the ministry, I said, yes, we have to inform the people of St. Lucia what is happening in the health sector. So we have a media and communications unit, and we issue our statements every day. We can't cover everything. And so now, persons are asking a whole lot of questions. It looks like they expect a camera hidden at the ministry, so everything we do, they have to see everything. We inform them, Mr. Speaker, of what's happening in the health sector. Mr. Speaker, as I continue to visit St. Victoria Hospital, I am very impressed with the young people I see working there. For example, a dietitian who is very clinical in the work she does now with patients, Mr. Speaker. She goes around to every bed to find out what is up with each patient, whether they are allergic to any particular food, what is their condition, so she knows what to prepare. She trains the people working along with her, a young lady, Mr. Speaker. And she's given her own report, Mr. Speaker. There's not enough time to go through it. But imagine, Mr. Speaker, I'll just give you some of it. Diversification of the menu, food waste minimization policy, signage of work areas, labeling of food items, dietetic intern form, standardized recipes. Mr. Speaker, there's more that she's doing and accomplishing at the hospital. New nutrition labs that she pressed for, and that is now here. Mr. Speaker, do you know, from April 2014 to March 2015, they served in October 11,617 meals. In December, 11,011 meals. January 2015, 10,940 meals. Varied, Mr. Speaker. And I've been there nighttime and daytime and see how food is prepared, see how food is served, and the patients now eat, Mr. Speaker. They eat because they are catered to individually. And when we see young people working so hard, and you hear the negative in the media from people who ought to know better, it is discouraging for the young people of this country. But I say no matter what, press on. Other people have other agendas. In the pharmacy, Mr. Speaker, again, young people working in the pharmacy. Prescriptions filled in 2014. The total for January, 2,826. April, 2,762. In July, 2,698 prescriptions. People who come out from private care come to the Victoria Hospital from all over because they can afford to pay at VH, Mr. Speaker. And the same applies in the public sector. When you see an increased number of persons working in Victoria, it's because they cannot pay at all times in the private sector. We have recognized an increased number of clients accessing care at the public facilities. Dennery Hospital, Mr. Speaker, was opened on the 15th of July. Mr. Speaker, during that time, new cases, urgent cases, 4,573. During the 2014, 6,482 people were attended to. Achievements, Mr. Speaker, independent urgent care department, armed security posted at the facility 24 hours, Mr. Speaker. Grosile, as you all know, Mr. Speaker, we increased the hours of service at the Grosile Polyclinic from January 2013. And we continue to facilitate, Mr. Speaker, from 4:30 to midnight. For the year, 7,714 clients accessing care at the Grosile facility. That's just the hours from 4:30 to midnight. The total number of encounters for urgent care for the period was 15,951, Mr. Speaker. Average number of lab samples collected, 481. Emergency transfers, 27. X-rays taken, 99. Mr. Speaker, it goes on. The staff doing the best under the circumstances, Mr. Speaker. And they're collecting the monies as well. Hospital fees and X-ray, 50,550. Medical fees, 288,206. Dental fees, 21,000. Laboratory fees, 152,000, Mr. Speaker. And they're doing the best that they can. Soufriere Hospital. And of course, Mr. Speaker, I need to indicate the construction of the new admin building will cost $797,598.48, being by the World Bank, Mr. Speaker. We move on to Soufriere. Refurbishment has to happen, Mr. Speaker, but as the Prime Minister alluded to in his address, that there is a vulnerability study that has to happen to find out whether it's necessary, whether it's absolutely necessary to remain in the present location or to relocate the Soufriere Hospital. We know it's an old building, it's infested with termites, it sits on the riverbank, so, Mr. Speaker, we have a technical team will assess completely what the situation ought to be for the Soufriere Hospital. Soufriere serves a vast number of people, and of course we cater to the visitors who come to Soufriere, engaging in adventure, snorkeling, swimming, climbing of pitons, and so we have to ensure that we have a very strong health service going on in the Soufriere Basin. And for that, Mr. Speaker, we will assess the situation with help from the World Bank, and the determination is made as a government, we will move on to ensure that there is the best service for Soufriere residents and visitors of this area. But, Mr. Speaker, a lot has happened at Soufriere. Total medical scene during the period, 2014, 3,610. Casualties dealt with, 7,753. Men's health, 163. Psychiatry, 157. Mr. Speaker, I move into domestic violence, the Department of Gender Relations. And I will move very quickly into suicide.
Honourable Member, you have 15 minutes remaining to complete your contribution.
Thank you very much, Mr. Speaker. Mr. Speaker, domestic violence, gender-based violence, intimate partner violence, however you want to refer to it, Mr. Speaker, we have this social ill in St. Lucia. And there are a number of support services or centers in this country. And we get referrals to the Women's Support Shelter. From Cornerstone, Red Cross, Women's Support Center itself, the police, the Wellness Center, Division of Human Services, the Vulnerable Persons Unit, the Family Court, Turning Point, NEMO. Support referrals come from all these agencies, Mr. Speaker. And support is requested on behalf of men and women, but the shelter only houses women, Mr. Speaker. During the period January to December 2014, 51 cases were dealt with, Mr. Speaker. Mr. Speaker, I'm very happy to report that as we speak, the center has reopened. The doors are open to receive clients. A total amount of $400,454.24 is spent renovating the Women's Support Center. And Mr. Speaker, I heard the leader of the opposition in a discussion asking about it, and I say to the leader of the opposition, if she doesn't believe me, feel free to visit the Women's Support Center, or better still, call the number 202. This is the hotline to get to the Women's Support Center. So if you don't believe what I'm saying, in terms of renovation being complete, open with security systems in place, everything in place, feel free to visit, but call first the toll number 202. But Mr. Speaker, as we speak of violence against women, violence against men, which will move us into the suicide situation, Mr. Speaker. And I want to quote from this document, Global Status Report on Violence Prevention 2014, coming from the WHO, World Health Organization. Many leading causes of death, such as heart disease, stroke, cancer, HIV/AIDS, are the result of victims of violence adopting behaviors such as smoking, alcohol and drug misuse, and unsafe sex in an effort to cope with the psychological impact of violence. Mr. Speaker, identifying some of the behavioral and health consequences of violence, mental health and behavioral, alcohol and drug abuse, depression and anxiety, post-traumatic stress disorder, eating and sleep disorder, attention deficit hyperactivity, smoking, suicidal thoughts, suicidal behavior. An attempt suicide may not mean somebody actually intends to commit suicide. It might be a cry for help. I need people to understand the difference, because there are people who don't know jack about suicide, but they start to talk. I'm talking about people who make noise all the time. Unsafe sex. They have physical, mental, sexual, reproductive health, and chronic diseases associated with violence, whether it be male or female. Mr. Speaker, let's move on into suicide. I am no expert, but I've worked in the area. And I can't count the number of persons that I've counseled to prevent suicides. So when I hear people talk all sorts of things about economic situation, that's why people are committing suicide. Robin Williams was a comedian, as rich as they come. He committed suicide because of a mental disorder, depression. So people have to be very careful what messages they send out to vulnerable people in this community. Because people are broke, they commit suicide. Mr. Speaker, this is not fact. It's not the only factor contributing to suicide. And we can see that. We can see that. Mr. Speaker, I speak and I refer to another document from WHO. But before this document, Mr. Speaker, I studied the area. So I stand here and speak because I know. Mr. Speaker, some psychological, cultural, and other factors can interact to lead a person to suicide behavior. But the stigma attached to mental disorders and suicide means that many people are unable to seek help. Not anybody pick up themselves and say, I want to commit suicide. Solutions don't do that. They just don't. They think they'll be laughed at. And so, Mr. Speaker, we continue. It's some of the factors leading people to think of suicide. And at the individual level, the risk factors includes mental disorders, harmful use of alcohol. Another factor, financial loss. That's another one. Chronic pain, and we all remember Dr. Kovakian. Family history of suicide. So we need to understand the thinking of people. Thank you, Honorable Member. Loss of relationship. It's right here, Mr. Speaker. He knows. But, Mr. Speaker, I used to think that this was not a reality, but it is, Mr. Speaker. I've come to accept that it's a reality in our culture. Yes, Mr. Speaker. And so, it did speak of a holistic way to address suicide, Mr. Speaker. A holistic way to address suicide and suicide prevention. And, Mr. Speaker, we are dealing with that in a holistic way. We have trained all our district medical officers, Mr. Speaker, in all 8 regions. We are looking at discussion, communication among all stakeholders from various departments and agencies. This, Mr. Speaker, we have called upon and been executed. The hotline 123 is already in place, Mr. Speaker. We will launch. And I want to say that another hotline was launched by Dr. Bray this morning. I will give the numbers, 458-2433, 452-5433. But our hotline is 123, simple, Mr. Speaker. But it's not only about the person who feels down and depressed that they will call, but it's family members. It takes a whole community to support someone who's feeling depressed. That problem we have in this country of consuming alcohol and abusing drugs, that leads to suicide attempts, Mr. Speaker, suicide thinking. It's a reality. And we need to speak to that. As leaders around this table, when we face the media, we need to speak to that. When we see our young people consuming alcohol and they're buried down in alcohol, all about having fun, we need to speak to that. And we need to tell people to support their loved ones when a relationship is broken. And my persons at the Mental Wellness Center said to me, we're looking at the data, most of the cases because of failed relationships in this country. So when people talk about economic situation, get your facts right and stop leading this country in the wrong way. And as for reporting, Mr. Speaker, we have to be very careful how we report, Mr. Speaker, because the copycat syndrome is very real. Sensationalizing suicide. The person who is down thinks that it is okay because of how it is reported. We have to be very careful. Mr. Speaker, in countries I know, suicide is not even reported in the media because it can spin over into a cycle. Right. But they don't want to hear that. Who are we to speak? Because, but I tell my professionals, they need to stand up and talk, but they're afraid sometimes because they are misquoted. Mr. Speaker, we have to be careful in this country when we continue to talk and we do not know what we're talking about. As leaders, do the necessary research. Ask a professional before we go out there in the media and just talk all over the place and lead people in the wrong way.
Honourable Member, you have 5 minutes remaining.
Thank you, Mr. Speaker. If you don't know, ask, simply tell people, support family members. Mr. Speaker, tomorrow I bury Flex. He was my good friend, and I know he was going through some of his own emotional problems. Mr. Speaker, unfortunately, sometimes families don't stand with their loved ones. And people take that as if it's nothing at all. We have to be very careful how we report on this. And Mr. Speaker, I want to move into human services quickly as I wrap up. Achievements from human services: the National Parenting Manual completed, pilot program for community parenting classes to commence in 3 communities. We thank NICE, who have promised to give us some persons to continue training and delivering the programs. Parenting is so important, Mr. Speaker, as we see our young people going astray. There are push and pull factors for our young people. What's pushing our children out of home? What's pulling them onto the streets? We need to find out. We know, but we must support them. Mr. Speaker, reviewed and adopted the national policy on mandatory reporting of child abuse, a silent problem in this country, Mr. Speaker, and we tell them, shout loud. There must be mandatory reporting by all teachers in the schools, and I thank the Ministry of Education for the support. Mr. Speaker, as I indicated before, residential space for our young people coming on stream very soon. Media and Communication Department, I want to thank Minister Fletcher for allowing us to get our own people within the media from NTN. Mr. Speaker, they work very hard. Television reports, 347. Radio reports, 332. Print, 310. Public service announcement, 15 within the year. All of that, they're running around the country, Mr. Speaker, with just one camera and sending out the messages and the announcements to the media houses to ensure the message of health goes out, Mr. Speaker. And Mr. Speaker, as people talk more about the health system failing, they have no idea what's happening in health. Environmental health, critical, Mr. Speaker. I spent one morning with one of my health officers on a cruise ship. Very early, the cruise ship came in, and they had to go into this room and go through report after report to ensure that everything was in place before the doors of that cruise ship could be allowed to open so the visitors could come onto the shores of St. Lucia. Our officers who are protecting our borders, protecting our shores, from the airport to the seaport. We don't talk about them. We just talk about the health system failing. Health is not about just hospitals. It's about environmental health, it's human services, it's gender relations, it's primary health care, meaning community health centers, it is health promotion, it's all encompassing, Mr. Speaker. And people who do not know about health should just keep quiet. And Mr. Speaker, with the 1 minute left, I want to say that we are transitioning from education to communication unit, Mr. Speaker. We're looking at health promotion, not just educating people, but promoting health and wellness. We're looking at health communication, health education, organization reorientation, community development and mobilization, policy development. Mr. Speaker, we want a healthy nation, which could be a wealthy nation. There'll be less money spent on dealing with diseases, the burden of diseases, out-of-pocket spending by individuals and the government. Because, Mr. Speaker, ever so often, so many people are still falling with NCDs. Hypertension, 132, increased by 31 from last year. Diabetes, 72, increased by 13. Diabetes and hypertension, 55, increased by 12. Mr. Speaker, behavior change is difficult. And so as a ministry, we'll engage our people in lots of different strategies and methodologies to get to an understanding about health promotion. Mr. Speaker, I wish to thank you for listening. I thank the Honorable Minister for Finance, for his presentation, and for the message of hope that he has delivered to the people of Babonneau and the people of St. Lucia. And I say to you, Mr. Speaker, I shall work diligently with honesty, showing accountability, transparency. I shall work with integrity, sincerity, and humbly, along with my Prime Minister and the team, to deliver to the people of St. Lucia. I thank you, Mr. Speaker.